Good morning, everyone. I'm Yuang. Today, I'll be presenting on cerebral palsy, overview, impacts, and social stigmas. So a quick introduction about myself. I'm a high school junior at Hwa Institution in Singapore. This year, I'm the leader of Project Synapses 2022, which is a service learning project that aims to both mentally and financially help cerebral palsy patients. I'm extremely passionate about global health and medicine, and I'm looking forward to going into medical-related fields in the future. Apart from that, I love watching soccer games and reading detective novels when I'm free. So, moving on to cerebral palsy, which is the main topic I'm going to talk about today. The definition of cerebral palsy is a group of neurological disorders caused by abnormal brain developments or premature birth. A very widespread misconception regarding cerebral palsy, however, is to link it with intellectual disabilities. This is completely wrong. Cerebral palsy and intellectual disabilities are not directly related because these two phenomena are caused by damages to two separate areas of the brain, though these two conditions tend to occur concurrently. So what exactly is cerebral palsy? Cerebral palsy is a disease that affects a person's ability to move and maintain balance and posture. It is the most common cause of childhood disability in the world, affecting ranging from 1 to nearly 4 infants or children per thousand. Currently, just in the United States, about 764,000 people are living with cerebral palsy, with 500,000 of those being children and teens. The symptoms of cerebral palsy vary from person to person. Patients with severe cerebral palsy may not even be able to walk and require lifelong care, while patients with mild cerebral palsy do not need any special help, even though they may walk a bit awkwardly. There are 4 different types of cerebral palsy, namely monoplegia, which affects only one limb of the body, usually one of the arms; hemiplegia, which affects one side of the body, including the leg, trunk, and arm; diplegia, which affects either both arms or both legs; and quadriplegia, which affects all 4 limbs, trunk, and face. People with cerebral palsy may also experience a range of physical and cognitive impairments. According to statistics, among cerebral palsy patients, 1 in 3 is unable to walk, 1 in 4 is unable to talk, 3 in 4 experience pain, 1 in 4 has epilepsy, and 1 in 2 has intellectual disabilities. However, there is currently no cure for cerebral palsy. But some treatment can significantly improve the lives of cerebral palsy patients, such as physical therapy, occupational therapy, speech therapy, drugs to control seizures and relax muscle spasms, surgery, and so on. Generally speaking, the earlier the treatment begins, the better chance children have of overcoming developmental disabilities. Unfortunately, not every region across the globe has easy access to all the aforementioned treatment, which hence leads to a difference in the prevalence of cerebral palsy in different places. It has been reported that a higher prevalence of a disease is linked to lower income as well as rural residential locations, where premature birth, low birth weight, postnatal injury, poor nutrition, and other risk factors for cerebral palsy are more likely to occur. In fact, based on a study, around 30% of cerebral palsy cases are statistically attributable to inequality in socioeconomic status. Furthermore, compared to those who live in developed countries, children with cerebral palsy who live in developing countries tend to have poorer outcomes and higher chances of comorbidities. At this point, you may ask, how are we involved in this after all? Well, apparently, cerebral palsy patients and their family members not only need to try their best to deal with the physical health issues, but also the intangible social stigmas existing around them, which are manifested in various countries worldwide. The typical social stigmas and mental stress that cerebral palsy patients and their families face include but not limited to lack of support from their other family members in the process of caregiving, feeling being isolated from other community members and receiving no support from them, loss of family joy, and discrimination against them. Moreover, sometimes those families may even experience environmental stressors, such as a lack of inclusive public spaces and a lack of options for public transport. Some mothers from those families reported that they feel they're living with shame and disgrace, and they have to minimize their social interactions due to the loss of family-based mindset. Such discrimination against cerebral palsy patients has not been able to overcome by society yet, which is hence something that requires our collaborative efforts to address. So the question now becomes what we can do to help cerebral palsy patients and reduce the social stigmas that they are still suffering from. Well, I believe that first of all, we need to have confidence. A cure for cerebral palsy may require a long time to have any meaningful breakthrough, but social stigma is something that can be reduced relatively more easily as long as the whole society is willing to endeavor towards the same goal. In a more practical sense, I think that organizations that address cerebral palsy in different countries, such as the United Cerebral Palsy Association and Cerebral Palsy Alliance, should provide useful platforms for cerebral palsy patients and their families to tell the public about the challenges they're facing. This can help us understand their needs more thoroughly. Also, these organizations may use social media to educate the public regarding the social stigmas, so that the existing discrimination against cerebral palsy patients may be reduced or even eliminated. All in all, I think the most important thing is to have hope that collectively, we are able to make a difference. Together, we can make the future better for cerebral palsy patients and their family members. At last, I would like to express my utmost gratitude to the organizers of the Johns Hopkins University Global Health Leaders Conference for providing us with a platform to share our ideas and experiences with our like-minded peers. I would also like to thank my parents, my teachers, as well as my friends who support me throughout this journey. Here are my references. And if you have any questions, do feel free to contact me via this email. Thank you so much for listening and attention.